As a medical consultant for the movie Contagion, Dr. Ian Lipkin foresaw the coronavirus crisis way back in 2011. And months ago, even as the world was coming to terms with the new virus, Dr. Lipkin was advocating the use of face masks, gloves and isolation. With over 30 years of experience in microbial discovery and outbreak response, Dr. Lipkin's every prediction about COVID-19 so far has rung true. As the virus spread, Dr. Lipkin was on India Today sharing his expertise on dealing with the pandemic. Now, as the world begins to open up, the global virus hunter is back. Dr. Lipkin, great to have you on India Today.
My pleasure to join you.
Before I start this conversation, I want to show you some of what Dr. Lipkin has said so far to our viewers to give you some context, and then we'll build on where we go from here when it comes to living with the coronavirus.
Internationally recognized as the boss of all virologists, Dr. Ian Lipkin, one of the few global experts who was in China to investigate the outbreak of the coronavirus. He flew to China earlier this year to consult with local health officials on their response to the coronavirus outbreak and quarantined himself for 14 days in February after returning to the US just to be sure he wasn't sick. Ironically, the global viral hunter revealed in March that he had tested positive for COVID-19.
I developed fever, cough, I had a headache, and I had a persistent cough that lasted for almost 2 weeks. But for the most part, I was spared, some of the respiratory compromise that many people have, fortunately.
In his 3-decade-long career, Dr. Lipkin has many path-breaking firsts to his name, and over the years, he and his team have discovered or characterized more than 500 infectious agents. No wonder then that Dr. Lipkin was also one of the first to sound the warning about wearing masks and gloves and maintaining social distance in containing the coronavirus.
The distance that seems to be important is somewhere between 1 and 2 meters. So we encourage people to wear gloves. We think this is safer, at least for them. Selfishly speaking, if you can avoid touching certain types of surfaces, you are much better off.
And it wound up in an unforgettable journey.
With over 30 years of experience in diagnostics, microbial discovery and outbreak response, Dr. Lipkin even predicted that the coronavirus is not going away anytime soon.
Well, I don't know that there will be an end for this particular virus. It may, like influenza or measles, become something that we live with, develop vaccines for. It could well be that this is back with us again next year.
If you test and isolate early, you can contain this and limit your damage. Loss of people, morbidity, mortality, economic slide, all of these things will be in better control.
Now as the world begins to open up, Dr. Lipkin had these words on what the new normal will be.
And you can identify clusters of disease early on, then you can just isolate those people. I think you're going to be able to get back to a situation where people can at least get into jobs as long as they protect themselves appropriately with masks and gloves and try to get some sort of physical distancing.
My talk today is...
And today, the world-famous virus hunter is back. Bureau Report, India Today.
To make this conversation most useful for everyone watching, our producers have put together 9 questions, which I'm sure would have crossed your mind at some point in time or the other. And in Dr. Ian Lipkin, we have the best quality global medical advice you can receive on each of those questions. So Dr. Lipkin, welcome. I'll take question number 1. As India and the world starts to reopen, what do you think is safe for people to now be doing? When they plan trips out, what do you think they can and should not be doing?
Well, the first issue is public transportation. And India, in particular in the large cities, just like New York, we have buses and subways that can become very crowded. We need to find ways that we can stagger the schedule by which people return to work so that we minimize the distance between people. We also have to ensure that people do wear masks We have to continuously clean surfaces that they may touch, which can themselves become sources of contagion. So that's the first pillar of safety, I think, is to address the challenges with transportation. Then in the workplace, we have to ensure that when people are, particularly indoors, that there's enough space between them so that if someone is sick, they're less likely to transmit disease to someone else. We believe that it's important for us still to wear masks. Any sort of mask will do. The objective here is to prevent people touching their face, conveying the infection either to themselves or to other people. Here again, we have to maintain strict hygiene. People should be washing their hands frequently. When they can't get access to running water, we need to provide some sort of access to a solution like a sanitizer, which will allow them to reduce the amount of virus that might be present on their hands. We appreciate that this is going to be enormously inconvenient and very difficult, and it is important, therefore, that we focus on trying to get to a vaccine as rapidly as possible. I am aware of at least 80 vaccines that are now being explored worldwide. I'm very excited about at least 3 of them, and I am confident that if we can stay the course and minimize contamination over the next several months, that on the other end we will have a vaccine that will be capable of protecting everyone. It will then be critical that people accept this vaccine. In some parts of the world, in some groups, people are saying that they don't want to take the vaccine, that they think the vaccine might cause autism or cancer or some other sort of problem. There is no evidence that that will be the case. When a safe vaccine is mandated by your government, by our government, this is something that everybody should line up for.
How long do you think it will take for the first vaccine to come? Not just clear the clinical trials, but to be available at scale globally, and by when do you think it could reach India?
I think that when it reaches India will be up to the Indian government. But I am hopeful that you will have a vaccine by this time next year. We are projecting in the United States that by spring of 2021, so perhaps March or April of 2021, we will have a vaccine. We have established an office within the White House where people are focused on this and are pushing as hard and as rapidly as they can. And I'm sure that Prime Minister Modi is trying to do the very same. And if there's any way that I can be helpful, please ask.
But till about the middle of next year, you're saying people will have to get used to the idea of living life virtually the way that they have been for the past 2 months. Is that the broad message that you're giving to our viewers, Dr. Lipkin?
No, I think we will be able to be somewhat more flexible. So at least in New York, we are beginning to come out of our houses, out of our apartments. And I think the same thing will be happening in your country as well. I know that you're beginning transportation again. And so there will be some flexibility, but that flexibility will come with risk. So you cannot let your guard down. You need to engage in the kinds of activities, the distancing, the hygiene that will protect you. Now, the people on whom this poses the largest burden are the poor, the disenfranchised, those people who live at the margins of society who don't have the resources, and we need to take care of them. There are 2 reasons for this. One, of course, is that it's the right thing to do. But the other is, even if you're selfish, it's the right thing to do. Anytime, anywhere in the world, anyone is infected with one of these emerging infectious diseases, it is a risk to us all.
Would you be socializing more, Dr. Lipkin? People haven't been out of their homes for 60-odd days. They've not met their friends, their family. Now they're saying, okay, the lockdown norms are easing. It's possible for me to go out. Is that a good idea? Is it safe to go to a family or friend's home, spend the evening there?
I think it is. But again, you have to follow the kinds of prescriptions that we've just talked about. When you're not, for example, if you're eating or drinking, you cannot wear a mask. But when you're not eating or drinking, this is something that you should be doing. You can also maintain distances between people. I was at a company yesterday where I saw people sitting in a lunchroom 2 meters apart. They were still able to carry on a conversation and while they enjoyed their meal. So this is something that can be done. I agree that it is not convenient. I agree that it's difficult. It also happens to be necessary. Now, there are situations where there will be people who will be immune to the virus, and although the antibody tests are really not yet reliable, they will be soon. And then you will be able to identify people who are truly immune, who don't have to worry about becoming reinfected, and who presumably cannot become people who are capable of transmitting disease. So there will be options, I think, to improve the amount of socialization we have as we move forward. I do not like the term social distancing because it implies that we are putting up barriers between people and the way they think and they interact with one another. I much prefer physical distancing. There has been an enormous burden on mental health with this virus because you have people who are dying alone, you have people who are becoming depressed. So let us please substitute physical distancing for social distancing. We still need to interact. This is what makes us human.
Dr. Lipkin, some offices have now started reopening and people have the choice. Should they stay back and work from home? Should they go back to office? How can they make their trips to office safer? What is it that's okay to do in office? What's it that's not okay to do in office?
So obviously, if you have a private office, a private room within a business, then there is no associated risk. You go inside, you do your work there, that is fine. The reason that most people want to go into work is that they want to have an opportunity to interact with their colleagues. To do this, you need to bear in mind the same rules that we've had already for minimizing risk. The 2-meter distance between people in a conference room, for example, wearing masks. All of these things will be enormously helpful and will allow you to have conferences. If you can't get what you need through some social media platform like Zoom or Skype or whatever the other ones are, there are so many of them now, then I understand that people will want to try to meet in person. As much as we can minimize that, we should try to do so. Again, this is not going to last for the remainder of our lives. This is a period of several months. We can get through this. And until we have everyone vaccinated, anyone who is not vaccinated, who is not protected in this way, is at risk.
Would you go to a restaurant and eat now that eateries are opening again?
I would. And I would use the same sorts of rules that I've just laid down. So the servers are, should be wearing masks and gloves. We need to trust that they're going to be safe in the way they handle themselves. There's no question about that. And then if I'm sitting down with somebody who is potentially at risk, if it's not somebody who lives with me like my wife or my child, then of course I have to maintain the distance that we've already talked about. Now, there are ways to do this, and there are some restaurants that are actually putting up partitions between booths. I'm not suggesting that that's necessary, but it is certainly possible. And I'm eager to do this as well as to travel. But again, I think there are things that we need to optimize until we can do this safely.
Would you step into a store to shop, go back to a mall because they have air conditioning, they're largely closed? Is it safe to go back to malls and shop?
I would do so. Again, I would wear a mask and I would wear gloves. The virus doesn't live forever. If it can't get into a suitable host within a period of time when it cannot survive on a surface, so on plastic or metal, that's about 72 hours. On cloth, it's much less. It's a matter of a few hours. You don't have to worry. You bring it back. It sits in your, on the floor. You don't interact with it. And then certainly within several hours, if it's cloth or paper, or within, 2 days, if it's metal or plastic, you can handle it safely. When you bring in foods, you need to wash them. But again, I don't think that people should be crippled. You just need to use common sense.
People need a haircut, many of them, including me, desperate now for desperate for haircuts. So that's where you got your barber right on your head. Even if he's got a mask, everybody would be wondering, is it safe to go back, Dr. Lipkin, to a hair salon?
This is one of the more risky things, unfortunately, because this is a very intimate relationship you have with your barber, your hair cutter. I'm not sure quite how to deal with that. You need to wear a mask. The barber or the hair cutter needs to wear a mask. He should also be wearing gloves, or she should be wearing gloves. It's tricky. That's a bit more difficult. And my heart really goes out to these people who are engaged in these occupations where they are at risk. And they have also lost so much income, because that's not something that they can do remotely.
Should schools be reopening? I have a 4-year-old son. Should he be going back, or is this whole year written off and he just stays at home, and then it's between me and my wife and me, and what we can do to try and teach him, apart from what the school is trying to do online?
This is one of the most difficult things that we face. So I have 2 stepchildren, both in college. They're both taking a semester off. They've decided they don't want to do distance learning. They feel as though they would be losing much of the experience, which is important, particularly if you go away to school. In primary school, it's even more difficult. Now, the difficult thing in Indian society is that you frequently have many generations that live together. You have grandparents and parents and children. And the grandparents, and sometimes great-grandparents, are at particularly high risk. Even though children may not be ill themselves, though they are not necessarily exempt from becoming ill, as we've learned, there are some very strange infections and there are ways in which children can develop severe disease, they may bring this home and infect their grandparents. So the risk is not even so much for the child, the risk is more for the other people in the home who might be susceptible. So this is a very difficult question to answer. I think that if I had the option, I would really push for remote education if I could, despite the fact that this is very difficult. Because right now, in particular, it's difficult to get children to understand how they have to protect themselves. Again, our hope is that we are going to have a vaccine and many of these kinds of issues will dissolve. But the fact is, in the history of the world, we essentially lost several months. It's very difficult. I appreciate that.
What's the guarantee this won't come back? You've got one kind of virus. From what I was reading about what happened in 1918, the virus mutated. The third wave was even stronger. So far, all experts say the COVID-19 virus genome is relatively stable, but they also say that could change. Is this just a one-off? Could this happen again in our lifetime? Or could it happen just a couple of years later?
Well, I don't think the virus is ever going to go away. So it's not really an issue of it coming back. When people talk about it coming back, what they typically mean is that there's an increase in the number of people who become infected and who develop disease. And sometimes that's seasonal. Why is it seasonal? There are many factors that enter into that. One is that the intimacy of cold and rainy months where people tend to be indoors facilitates the transmission of the virus. The other is that they're under colder temperatures. The particles that carry the virus are lighter and they travel farther with a cough or a sneeze. And some combination of those probably accounts for the fact that there is a small dip and then an increase again. And the other thing is that although we talk about the virus as being more common or less common To some extent, that reflects how many tests we run. The more testing we do, the more we find. So it's difficult to look, for example, from day to day and say the virus count is dropping or the virus count is going up, because it's a question really of ascertainment.
Would you take a flight? Flights open in India very soon. People will wonder, is it safe to be on a flight again?
If one were to go on a flight at this point, I think there are certain measures that you should take. We know that the virus entry is through a mucous membrane. That means the mouth, the nose, or the eyes. So if I were flying, number one, if I couldn't ensure that I had a certain amount of distance between me and other people, I would wear a mask, I would wear goggles, and I would wear gloves. That is the safest way to travel. Does it look strange? Is it scary? Yes. But if you have to travel and you do those things, you should be safe.
People have been cooped up at home, not really wanting to venture out. Now they're saying, is it safe to go back and play outdoor sports?
So if you're talking about contact sports, right, which is what most sports are, unless you're talking about playing golf, right? This is a challenging issue. Now, in the United States, we're looking at this intently and asking whether or not, for professional sports, it makes sense to test people to see whether or not they're infected prior to the time that they go into a game. And there are more and more of these on-site diagnostics that one can use. They're not yet as reliable as I think they will be, but there are ways in which you can reduce risk. We're doing the same thing in the film industry and television industry, where we're trying to find ways in which people who have to be in very close quarters and can't wear masks because it interferes with their ability to perform their art have to be somehow cleared so that we're sure that they cannot infect one another or members of the cast. So it's the same sort of challenge in sports as it is in the performing arts.
The American president said he's been taking hydroxychloroquine, and there was much mirth and consternation about that. Is there any pill that you can pop which kind of builds immunity and helps you keep the virus away?
I don't know of any. I understand that, he seems to have a different line on this, and I wish him well.
You're so diplomatic about that. He's not consulting with doctors, or at least not serious doctors who'd advise him to go for this, and yet he's doing so. But we've really had a very interesting conversation. You've explained in as easy ways as possible what people can and cannot do, what people should and should not do, how do they live with the virus and yet not let the virus take them down. Dr. Ian Lipkin, you're looking healthy, you're looking well. Last time you were just coming out of your bout with the COVID-19 that had taken you down just a bit, but I'm glad to see that you're bouncing back. Thank you so much for joining us. It's a delight to have you.
My pleasure. Always a pleasure.
Thank you so much. Wish you all the best. Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.